Welcome to the Mental Insights Podcast, a conversation aimed at understanding all sides of mental health, addiction recovery, and homelessness. Each interview will include one's personal experiences and insights, or an expert's advice and knowledge within one of these fields. The goal is to promote awareness, guidance, and support for anyone who is affected by these challenges. Thank you all for listening. Welcome to the Mental Insights Podcast. This is your host, Brendan Cutuli. We are here today for Season 2, Episode number 13 with Kristi Dename. This is Part 2 of this episode. In Part 1, we spoke about Kristi's personal experiences as well as her transition into EMDR therapy and biofeedbacking. Within this episode, we're going to speak a lot within trauma and what people are facing today. And to really start it off, just within what kind of one segment of trauma being, there's organization RAIN that stated a statistic that said 8 out of 10 sexual assaults are committed by someone who knows the victim. So this is showing just the severity of, what is really going on within trauma today. And many people are experiencing traumas, not only sexual assaults, but there's many countless different challenges that people are putting in place, and especially childhood trauma is a large severity of what people are experiencing today. So can you just speak about the severity that we are seeing within trauma today, and why it needs to be on the forefront of the therapeutic measures that we're doing today, because it's really at a substantial rate within our society?
Oh yeah, absolutely. I mean, those statistics are definitely accurate. And I find anyone that comes in for whatever it may be has unknowingly gone through some type of trauma. And I think a lot of people discount certain events if they're, let's say, cumulative trauma, and it's little mini ones that start had that snowball effect on us. And they think that has to be the stereotypical or the big major ones that we know of. And because of that, then those people may never acknowledge or work through it. And when we do that, these little seeds they're planted when we have any type of traumatic experience. So I think it's important to mention too that trauma is essentially when our coping skills are not, we don't have enough coping skills to handle what just happened. And although we're very resilient and we can keep going on, it's, if we don't really process and heal through what just happened, it's going to cause so many other issues and damages in your life, whether it's having unstable relationships, not being able to keep a job, not having the self-worth enough to go forward to do things that you're deserving of and be in healthier relationships and situations, or to actually allow yourself to commit to something too and not get so overwhelmed that you avoid everything. It's also, people with trauma can become abusive themselves if they were shown that type of love or associate love with harm. Then they might take that out in their adult relationships, or they might seek someone and stay with someone who's abusive because it's familiar and associated with love. And another piece, a key component of trauma too, is when a worldview is shattered. So, for example, if you look at a child, when they go into preschool, let's say, they might have this idea that everyone's really nice, or all adults are really nice, especially if their caregivers are great and safe and have a healthy approach with them. So that's what they start, they associate people with. Just as they associate red with the color red and that crayon, whatever, however, it same goes with abstract ideas. So now they go into school and maybe a kid grabs something from them or says a hurtful comment, or the teacher calls them out for something and they get in trouble. if they have biologically an extra sensitive nervous system and awareness, they might already right there have a trauma, like a mini trauma, because now their worldview is shattered. Like, oh my God, not everybody is nice, and I can't trust everyone. And what is this pain I'm experiencing? So if they never had that prior, they most likely won't have the equipped coping skills and mechanisms in hand. So they might go home crying. They might not want to go back to school the next day and not even know why. And the parent's just like, I don't know what's going on. And they won't tell me because obviously the kid can't verbalize, I just had a really bad encounter with a person for the first time. They just know, I don't want to go back. I don't want to have that pain again. So that's where things can get crisscrossed too. Another example could be a child falls off the swing, and one kid, again, depending on their sensitivity level, might just be like, okay, whatever, and get back on it, or run off and not care and go on it the next day. Where another kid's gonna fall, notice everybody that might have looked at them, assume that they're making fun of them, be terrified of the swing, now be terrified of taking risks, and now this is a seed planted, right? So they don't want to go on the swings again. And now they might, like even what happened with me with the food and the restaurants, now they might start associating risks in general with a loss of control and just bad. So these little seeds can get planted with everybody. And again, it can be any shape or size. It could be as simple as your mom overly reassured you and joined your emotion when you were upset with something. So that's going to create you to have more intense emotions and fully just believe them all the time and get in them and mesh with them and act on them, instead of a validating, soothing parent who would be like, address it as, oh, you're having this really big emotion. It's called sad. This is what we can do about it. How does it feel in your body? What do you want to do about the situation? That's navigating an emotion and an event, right? So another that example, and the parent's not intentionally harmful or malicious, right? So you wouldn't think that's accumulating trauma in a way of how to handle situations. Her in herself doing that with you may or may not be traumatic if she, like your parent, mom or dad, overly joins with you, because that can be scary too if your parents like, oh my God, oh my God, oh my God, and frantic with you. Dismissive parents too, like the get over it type, over and over, can be accumulated mini traumas, and sends the message to the kid, you can't trust your emotions, you're wrong for feeling them. The kid still has emotions and they're like, well, what do I do about this? So then they internalize and might obsess and become someone later in life with OCD or just excessive rumination. So I do stress with clients and just anyone that it's all trauma is respected. It does not have to look a certain way. And if we don't acknowledge it, and like you said, the severity will be so much more prominent in how it manifests later on. And it can cause, yes, self-harming, self-injurious behaviors, suicidal tendencies or attempts, or just fantasizing about it, avoidance completely of any distress. And we see this across the board in all different behaviors. And of course, on society, it can be really excruciatingly harmful, where we have, if we get into all that, then, mass shootings or just people within households, abuse or sexual abuse, anything like that will happen. And like I said, it can be so where people just have no idea and they blame it on so many other things instead, and blame it on other people. If they didn't act this way, I wouldn't yell, or if they didn't do XYZ, then I wouldn't have to hit them. It's just, we can blame, and so many problems will happen.
Certainly, yeah, and it can't even be subliminal blame, whether it's like on themselves or there's so many different avenues of which we can see, and especially like you're saying in terms of it can be mini traumas, or as well it can be something that's a large event. There's many different ways that you can do it, and ways you can experience this. But I think for a lot of people, especially when, you can look at the aspect of if you're a child and you're kind of really anybody who's going to, have and really pronounce a trauma on yourself, it's going to be somebody that you know. So it's whether it's somebody you live with or, like you're saying, somebody you go to school with. But as well, then once you become an adult, you have many different avenues if you can become in touch with anybody, especially if you
Mm-hmm.
look at the internet today. And I want
Yeah.
to know, what really can someone do if they live or if they work with someone who has caused their own trauma?
Yeah. That is one that can happen with certain clients, and it's very tough because we have to kind of be a little more gentle with them to know, okay, you're going back into the environment where it's caused, or that dynamic is just toxic for you and you might have no means yet to get out. So let's say it's a 20-year-old and she or he has to live still at home because they can't afford to live elsewhere, and they just have a tumultuous relationship with a parent or sibling. They We can only do so much. So it's, no matter what, I really emphasize that anything we do together and the skills and the coping strategies is for them. So it's not to make the other person not yell, or like to make it better for both of them in a way. I emphasize that this is so you don't get super worked up in your body, so you still live a full life outside of the environment. So we can have strategies to keep distance and boundaries, and that can influence the other person's behavior because you're not doing the same dance with them, right? So if you take a step away now and they weren't expecting that, they're gonna like flounder for a bit and change up how they respond. So you can have an influence. If they're very malicious and abusive, the influence might be still very small and they'll still always find a way to put it back on you. In that case, we would look at, that would be a different scenario of getting them out of there. But so it really depends on the position, the job too, if it's at a job, like how important it is to them, what type of trauma it is, and if it was once like in their past, let's say, versus present day. That's also a different scenario. I've had someone with their sibling, they had sexual harassment as children, and then as adults it's not even acknowledged. The other one didn't maybe even remember or recognize, or they just unspoken. So you're living with a person that was involved in your trauma and caused it. However, it hasn't happened. So that's a confusing one too, that I've had in certain cases to work through. And some people do choose to confront them and talk about it, and that helps them. So that does depend on what the scenario is. If it is on the job, of course, if there's human resources, then, or the boss, the employer, they should be alerted as soon as possible. And then you can decide, like I said, if it's important, you figure out how to stay, maybe switch to another department, shift hours around, get a new job entirely if it's just not avoidable. And then for the living environment, it's definitely crucial to have therapy and an outlet. A lot of friends, I would encourage them to really build up and connect with those who are kind, loving, and supportive in their life. And if not, to seek out those relationships and find them and build them in more positive experiences outside of the home. For school, that one is very tough because, as you mentioned, a bit of technology and online presence. Kids now, they don't walk out that school door and it's there and gone. They have it 24/7 now. So that one would be, discussing with the kid about the use of social media, of apps, how you can block people, as soon as you feel uncomfortable, whatever it is, like how to respond to it and how to keep self-esteem and not personalize it. So I definitely teach too, is to watch the thought process of blame. So especially with children and teens, we want to protect our parents or the people around us. And we tend to internalize and then shame and blame ourselves. Like we should be doing something better, especially because kids are more egocentric. Teens can be too. So it's like, what am I doing? What am I doing? It's not, we're not thinking this is their stuff. You know, they're operating from their stuff. So as adults, those, like I said, those seeds that get planted grow and grow and grow with every experience that is similar and confirms this limiting belief or seed that was planted of I'm the wrong one. So then as an adult, again, it's going to be just full of shame. I'm not worthy, and manifest in all different choices. So working on coping skills, ways to heal when you have to be around that person, especially if they're the most concrete and igniting trigger. That's trauma therapy is beneficial as well. Healthy boundaries, distancing as much as you can. And like I said, developing a lot of relationships and support outside, because that person might take you in, you know, and you'd be able to leave the house and then go have a new roommate or new life or move or whatever it might be. So yeah, it's definitely a good question though, because I do have cases where that's a big issue.
Yeah.
School-wise, otherwise too, is alerting, of course, teachers, the school psychologist, get you out of their classes that you share them with, things like that. Teaching them how to stand up for themselves.
Yeah, it's certainly quite the challenge, especially, you know, as we're talking about being a child. It's an environment of, you know, how do you even learn, you know, these added things of coping mechanisms of how to deal with your emotions when, you know, you're in such a time of, you know, even who am I, what am I trying to do? And I think that's what causes, you know, so much more distress, and why you see kids act out and all of these different measures. But, you know, within early childhood, I think, you know, there can be, you know, like we said, there can be causes that you can see and it can come into fruition 10 years later. And I want to know really, how can early childhood stress cause behavioral patterns later on? And, you know, how are you able to work with a client to take those step backs and try to learn new behavioral patterns as, you know, they're trying to bring out that child within them?
It's, you know, early childhood stress, obviously we're always going to have stress. There's good stress and there's bad stress, you know, or effective stress and ineffective stress, let's say. I would specifically look at the unmanaged stress. So if a child has good coping skills, then stress won't be as dire and as igniting, right? They'll be able to have resiliency, bounce back from it, know that they're capable and they can handle it, have that empowerment. Kids that are not taught that, or especially modeled that, if they see their parents approach problems or stressors with panic or anger or avoidance, they're going to learn that because they see that. So it's not always how the child is responded to, it's also what they see. And this then will definitely cause maladaptive behaviors in adulthood, because what happens or does not happen during our most impressionable years lays our blueprint or like framework or foundation of our brains and how we view the world. So it's like the way the world is being constructed, essentially all these building blocks kind of coming in of how our parents experience it, even like our most our closest caregivers, especially in the first few years too. We kind of swim in the pools of their consciousness for a while and how they see the world and what they teach us and what they do in it. So how we respond to it, I tell clients about their blueprint. So it's like, let's find your blueprint first, because if you had high amounts of distress that went undetected and unmanaged, it will cause a lot of emotional dysregulation as as a teenager or adult, or an angry teenager or adult. Someone also might have many physical ailments and chronic pain that can be really just internalized stress and emotions and trauma that lives in the body. There's a really great book actually called The Body Keeps the Score. I don't know if you've heard of that, by Bessel van der Kolk. He talks all about how trauma gets trapped in our nervous system because it's the information highway. So even if we don't allow ourselves consciously to remember, the body keeps the score and remembers for you. So physical ailments are definitely another way it can show up. You'll usually lack communication skills and understanding of how to take care of their health and well-being overall, and then just miss out on a lot of their lives because of being stuck in their heads and rushed bodies and patterns. So with the adults, they start having situations arise that only adults will have, and then that's really when you start seeing even more or hearing people say, I'm just like my mom, or when they're fighting, they'll be like, you're just like your dad, or blah, 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 because now they're seeing different things they've never experienced yet, and their only reference, unless, right, they unraveled through it already, but their only reference in their brain unconsciously too is going to be what their parents did, or what they saw whoever their caregivers were, or how they responded to. So we really dig through, figure out the blueprint, and then I'm like, okay, would you like to hold on to this, or you want to redo it and learn your own way? Like, genuinely, I'll ask them to your genuine self, what would you do in that based on your values? We'd search their values. Values help guide our decisions and behaviors more. So if they do value love and compassion, it's like, okay, how can we have your behaviors line up with that? What can we learn and undo that better serves your life now and it is in alignment with who you actually are? Just because our parents did it one way, or what we were shown was by other kids or teachers or siblings, cousins, whoever was around the most, we don't have to do it like that. And that's okay. And we don't have to blame them either. They did the best they could with what they knew. So it's just, that's that. And we now have this power to recreate.
Wonderful. Thank you for that, Kristi. And, this one question that I love to ask my guests, I think is a good representation of, the work that you're doing now, and as well the hopes that you have for the future and the drive that you have to take this next step. So for season 2, I like to wrap up every episode with this hypothetical question in order to see what your hopes and what your dreams are within the next step of the mental health industry. And this hypothetical question is that you're given, a large amount of resources. So we'll give you a large sum of money, and be, say $1 billion. And I just want you to give us a little insights of some of the avenues in terms of how you'd allocate, this amount of money, these resources, in order to, assist those who are facing traumas, who are facing other, psychological traumas, other psychological injuries, for people within any field that you're looking to assist within mental health. Where would you allocate these resources in order to, take this next step within the mental health industry, and maybe some things that aren't being done today?
Sure. Yes. So of course I've thought a lot about that. Just, I guess, being in this profession and being passionate about mental health and just health, right? So because I work with children too, I see first, just firsthand right there what it is they're experiencing and how they're experiencing it. And this also helps when I do work with adults who had childhood trauma, because I really know, I have the insight of what it looks like. So the school level, elementary level, would be amazing if every school had an emotional intelligence program. or class even dedicated every day to teaching about what emotions are, how to regulate them, biological changes in our bodies when we are under stress or anxiety, depression, just educating them, and then keep teaching, coping skills, self-regulation skills. And if they still, of course, therapy would still be there for a tailored approach if they want to work on one-on-one with a therapist about their specific, circumstances. So that would be definitely one, is mindfulness, all these great skills every day as a class. And then again, in middle school and high school at a higher developmental level for their stage of their brain now, right? And the events now at that age they're going to experience and how to apply it there. Because it's really not going to be a one and done thing in elementary, because you deal with elementary school kid problems. Then there's middle school kid problems, and then there's high school kid problems. So it's still just as important. If you start at the lower level, right, when the brain's the most influential and impressionable and the kids are still eager to learn, it's going to be a tremendous impact. That's it. Like, there's no way around that. They're already in schools where they do implement mindfulness programs, even if it's once a week, see reduced aggression, increased initiative to help each other, improved academics, just less bullying, more emotional regulation, coping skills, just general happiness. Like, it's just a slew of benefits. So that right there is just research-based too. There's no arguing that it's not going to be effective. And then kids go home too, and they'll, parents are overall, some don't care at all, I gotta say that, and they're just like, fix my child, or they don't even care to bring them in therapy. But a lot of them are eager and want the best for their kids. So kids can come home and teach them too, and then they learn with them. And I encourage, even with the parents in between sessions, to do these techniques with them, because, I'll be frank and ask them, how do they manage anger and whatnot? So that's definitely, I think, number one, is bringing it to the school level. And then we do see a lot of telehealth now for people that maybe don't want to leave the home, or they're busier and they do phone sessions, or they have like text sessions now. I believe that can happen, Skype sessions, whatever. I think it would be nice to see more urgent care type places for mental health. And this way you have, if someone's having a panic attack or something, or just in need, they go there, and then from there they can give them references of therapists to see, and just have that crisis, like distress intervention. So they're around, just like an urgent care, around whenever needed, or emergency room type, and they won't feel alone. I think just even knowing that's an option can help people too, that they're not alone and there's resources. And let's see, where else? It would be better departments, honestly. When I worked at the psych emergency room in Niagara, it was just, sorry, my battery's getting low. So it was just so much smaller, and it was not well kept, and it just was almost this hush hush corner, and isolated and labeled behavior. It just was, I don't know, just completely like 1/10 of the entire emergency room. So it's not, if it was taken more seriously, that would be great. And every hospital, honestly, it would be great if they had a department for it. And I think within the department too, they don't divide it well enough. So if they could, I would put money towards building better spaces. So you could have people with mild mental illness issues versus severe, because if people who, depending on their functioning level, are paired with people who are very ill and decompensated and not, they're delusional or screaming, whatever it is, that can be traumatic for somebody to go where they're supposed to be getting help, So I think that is really important too, is to have different, whatever you want, sections or whatever levels there. So I think that would be, yeah, most of it. I feel good about that.
Perfect. That's great. I mean, there's no wrong answers here. It definitely shows, what needs to, continue moving forward, whether it's funding, whether it's, allocating the right policies within states, and, just touching on what you're speaking about within education. If you look at all of those age groups, you're seeing physical education out all the way up through high school.
Right, exactly.
And there's not one class really. I mean, maybe under middle school you might have some health classes, but really they're more directed towards whether it's like drugs or just understanding more about your body. It's not really teaching you much within the aspect of mental health. And I think that just speaks about our society's viewpoint on physical health versus mental health, and how outdated it really is. I completely agree within that measure. One person I actually interviewed on last season, her name is Nancy Miller, and she owns the organization 1 in 5 based out of Ohio. And they actually recently just got a policy to institute education within, I believe it's early education. So I believe it's right before middle school. But those are the things that we need to be seeing. A lot of these policies made that, it's put into our education systems, which is exactly what you're saying. So I definitely think those are, the right next steps that we need to take within the field. And I'm so glad you were able to share those with us, and as well share your insights within EMDR therapy, biofeedbacking, trauma. These are all things that are, one, people are experiencing firsthand a lot throughout their life. And these are techniques that are, EMDR and CBT are things that are coming out new within a lot of therapeutic measures today. So it's great you were able to share about that with my audience, so they can get a little bit of a glimpse of maybe some things that they could be using within their own measures down the line. So I'd just love to thank you for taking this time with me, Kristi.
Yeah, thank you. It's been an honor, for sure. Anytime.
Definitely. As we were talking, there's so much more, as we were saying, to really dive deep within many of these topics. So I definitely think there will be another time to really speak more about some of these subjects, as we're saying, mental health is so important. We need to continue conversations. We need to continue bringing about these resources and information for people to listen to. So, this is one episode of the many that need to continue out there. So,
for sure. I'm so excited. I'm happy you're doing this. This is great.
It's awesome. It's certainly such an honor to do it, and to, hear some of this great information from, whether it's professionals, whether it's people that firsthand experience it. And usually it's a combination of both, which is definitely the great thing about it. So for anybody who is listening and wants to contact Kristi, you can go below in the show notes, and there'll be information towards Kristi's contact information, as well as some of the information that we spoke about today. And really let us know what you guys think about this episode. Like, subscribe, review, tell us what you think, and we'll be sure to, speak about some of the topics you'd like to hear more in a further episode later down the line. So thank you all for listening again. This was season 2, episode number 13 with Kristi Dename. And if you didn't already check out part 1, where we spoke about EMDR therapy and biofeedbacking, please be sure to check that out if you haven't already. So thank you again for everyone for listening. This was the Mental Insights Podcast with Kristi Dename, and I'm your host, Brennan Cutuli. Thank you all for listening to today's episode of the Mental Insights Podcast. Make sure to reach out to today's guest or myself if you need any advice, guidance, or support in your life today. Please be sure to like, subscribe, and review to this podcast so we know what you thought of this episode. I look forward to being in touch with you all in the next episode. I hope you all have a wonderful day.